Hello, this is Dr. Bafitis. How are you? This is another informational talk, this time about improving the quality of your skin. And literally after being in practice for 30 years, there's something that's been consistent over the last 25 of those years is how we could protect and take care of some of those aging spots that occur after pregnancy or from sun damage or in general, just as you get older. And the reason why that occurs for both men and women, why do you get certain blotchy areas? I want to show you here from this graph, which is an example of the top layer of skin, which is the epidermis, the middle layer, which is the dermis, and then the fatty layer. And as you see, young skin, aging skin, you start getting thicker and thicker epidermis. Also, the pigment cells, the melanocytes, get less as you get older. And this is true for brown, black, white skin. So you get lighter as you go along in the age cycle, and that leaves behind discolored areas. What can affect that prematurely is sun damage. Stress can do it, high cortisol levels, as well as pregnancy. And the other interesting thing is we see that the dermis gets thinner as you get older. And moisturization is a wonderful thing, but you need to have something that'll penetrate into that area. So one of the things that we've had here at the Plastic Surgery Institute, we compound ourselves, and you cannot get it without a prescription. You get it from us. We compound it ourselves. Is what we call our 1-2 punch. It is the Fade Renew, which incorporates a very mild retin-A, a very mild steroid that has no systemic, no general body penetrance. It just stays on the skin, as well as a bleaching agent, which is totally safe. Over my entire 30-year career, I've had no issues with that. And I literally have treated thousands of patients, as well as a moisturizer. And this Fade Renew, we've looked back on our statistics, we've sold almost 42,000 of these over the last 25 years that we've compounded. And we use this initially almost once or twice a week, and then we go to every other day, and then we eventually build up to every day in the evening only. And if you're going to the beach, you don't use it. As you progress along, and if you want it to penetrate into that dermis and also plump up that dermis and improve it, then we have 1% retin-A that we also compound with a moisturizer. And we call that the booster. And these work together. And I'm serious about this. All you need for the entire face and neck would be about 3/4 the amount of your small little nail. And you mix them together and you apply them. We will show you some pictures later of what this accomplishes to the face. And this will do its magic over the course of 3 weeks and then over the course of 3 to 4 months. We initially start you on the Fade Renew, and then after about a month or two, you'll go with the combination of the Fade Renew and the booster. Not only do you get an evening out of the pigmentation, but you also get a more plumper dermis and a generalized more glow to your face. Again, remember, you're not going to use this if you're going to go sunbathe for the day before and the day after. And if you have a laser, particularly a CO2 laser, an ablative laser, a burning laser, then we use this before the laser and then several weeks after to improve the quality of the skin. Retin-A has been around now for literally greater than 20 years, and it's been shown to improve the quality of the skin, to even out that epidermal layer, and to actually beat back skin cancer. So all these things are positive things for your skin. Again, we ask you to get online, look at some of our before and after pictures, and remember, this is a medical skin program. This is something that you cannot get without coming to our office. Soon though, especially with telemedicine, you'll be able to get this online. That is coming soon. So again,